afternoon, everybody. Welcome back to another episode of the Scholars Table. On this episode, we have a very special guest with us. He's currently a PhD student at Johns Hopkins Bloomberg School of Public Health. I met this particular applicant somewhere last year when we initiated our very first online class, the graduate school application masterclass. Was one of the applicants that we worked with who ended up getting admission to some of the prestigious programs you can think of, Johns Hopkins and Oxford University. So in this episode, I'm trying to understand his journey, his experiences back home in Africa, and what made him the candidate that he was in order to get into these programs. He's a medical doctor who trained at Makerere University and has a master's from Imperial College London with distinction. He has multiple awards and has won multiple fellowships, which I cannot highlight everything. So hopefully when he joins us, he will highlight a couple of these achievements. Without much wasting time, let's invite our guest, Oloom.
Yes, thank you so much, Dr. Banda. It's a pleasure to be here, having been visitor to your site for quite some time, and then I'm seeing other scholars on YouTube, following some of them on your LinkedIn, and it's just a pleasure for me now to come as a guest and talk to you. I think it's something that's very wonderful for me, and I hope we have an interesting chat.
I remember very well when I organized a master class and we were all in the same WhatsApp group. We started the process together. I would say challenging, but also rewarding, because I've seen a lot of you move on to very amazing places. So before we even begin, maybe you can share a little bit about yourself, your academic journey, professional journey, and what's like for you growing up in Uganda, and anything unique about the place.
Yeah, thank you, Banda. I think, like you mentioned already, I'm Ronald Olum. I'm a public health physician from Uganda. I was born and raised in northern Uganda. The northern part of Uganda is probably most known for over 2 decades of conflict that ended about 15 years ago. So I was born and raised in that kind of setting and spent part of my childhood in an IDP camp, and then did my primary school from there as well, until later when I joined secondary school and my med school. That's when I moved to Kampala, which is in central Uganda. So like you mentioned already, I completed my medical school from Makerere University in Kampala, which is the oldest public university in the country. And I was there on government merit for all the 5 years in med school. And then I went on to do a Master of Public Health from Imperial College London on full scholarship from the School of Public Health. And now here I am doing a PhD in infectious disease epidemiology at Johns Hopkins. So my research background, I mainly do research in infectious diseases, and I like to put myself in between two things: infectious disease epidemiology, that is to be sort of a disease detective, but then I also like to do implementation science work, which is really to try to be the prosecutor. So find what the challenges are, but then use implementation science to sort of see the best strategies to try to solve some of those issues. So that's just a bit of my background academically, but also the research that I do. You also asked one interesting thing about Uganda. I can speak lots of stuff that are interesting about Uganda. But I think one of them, which you probably know already, is that Uganda is home to the source of River Nile, which is the longest river in the world. So it leaves the country from Jinja and then goes up to Egypt and ends up in the Mediterranean Sea. But there's lots of other interesting things. If you like tourism, Uganda is definitely the place. We're probably one of the most famous birding country with over 1,000 bird species. I think we have lots of gorillas. I just forget the specific statistics, but probably half of the mountain gorillas are found in Uganda. We have so many national game parks. I've visited quite a number of them. But also there's a lot of diversity in a country like Uganda. I think we have more than 50 languages spoken in the country and tribes. Yeah. So quite a lot of things to speak about Uganda.
I think that's something unique about most African countries. Most African countries will have like tons of languages. So let's talk briefly about your academic and professional trajectory. You made mention that you're a medical doctor who worked in the clinic for a while, but what motivated your shift from clinical medicine to research in public health?
Yeah, so I get asked that question a lot, but I think it really goes back to probably my third year as a medical student, or probably even back, because research is really about being inquisitive. And I think I've been inquisitive for as much as I can remember. But specifically for research, what motivated me to do research? I was a medical student in my third year doing my junior clerkship at a national referral hospital in Uganda, and it was in obs and gyn. And surprisingly, I did not do research that is focused on obs and gyn, but that's where my motivation really started. I think that particular day, I was in the clinic, and then this young lady came, about 35 years old, very jolly, talkative, and friendly. But then we were informed that she actually had advanced cervical cancer, so she was on palliative care. It was so saddening for me because I had interacted with this lady before. She seemed like she had a lot of life left in her to live, but unfortunately, she couldn't live as much as she would have expected because she was battling advanced cervical cancer. So that day when I went back to my hostel, I was like, no, this is a very preventable disease. And there are quite a number of ways of preventing HPV vaccination and then safe sexual practices. So I wanted to really understand how that can be done. What do, for example, starting with university students, what do they know about cervical cancer, HPV vaccination itself? The bad news is that never came to fruition because I went back and forth trying to create the protocol, but then failed to complete that. But that really brought that first initial thought of doing research. Then later on, as a fourth year student, we then had a course on public health. So it's usually done in the fourth year of medical school. And we were placed in the communities to sort of do community assessment. And I was in Eastern Uganda for about 6 weeks to do that. So that time really brought me close to the community, try to understand things from the community perspective and understand, because in medicine, we usually care about the individual very much. But in the communities where these diseases actually start. So that was the beginning of that. And later that year, I was meant to do an elective, which you usually just select a hospital and then spend time in. And I had actually been awarded a very competitive elective to do my exchange from Yale School of Medicine. But that was the year for COVID-19. And I was informed a few weeks after processing my passport that I couldn't travel. So I was very heartbroken and decided to go back to the village where I come from in northern Uganda and do my exchange from that health facility. And that was another changing time for me because that's the time I saw something I saw in eastern Uganda as well. So this was northern Uganda in a district called Omoro, where I've spent probably most of my time as an adult. So I saw lots of young girls, adolescents mainly, coming to the health facility for antenatal care, others coming for post-abortion care, and a number of them discovering that they're actually living with HIV. So that really broke my heart. I also spent some time moving around the district supporting USAID funded projects like male circumcision. So that took me closer to the community than to the hospital. And I think when I returned, I spent lots of the rest of medical school that was left working with a number of mentors who I'll share more about when you start talking about that, to try to get rooted into research. So I spent lots of my time actually in medical school, particularly fourth year and fifth year, asking questions in public that I needed, particularly COVID-19, because that was the time. But then I expanded my portfolio to things like HIV and TB. So I think that was really the beginning of what research was. Even after finishing medical school and going for as my junior house clerkship, I think some of the challenges I faced working with patients really, you would find a person comes to the hospital with a very advanced disease that could have been prevented in the first place. But then when you ask, the issues are always around poverty, around other social determinants of health that prevented them from preventing the disease in the first place, but also secondary prevention, like preventing disease from progressing. So all those really pulled me back to think of health in terms of a population rather than an individual. And much of that started with understanding what's really happening, which is really research. So that's how I ended up where I am.
I think it's a very important blend of experience that you had. For most African students, for me, even my experience from medical school, you hardly get exposed to research. You hardly get exposed to going down to the community to be involved in some form of research. And what stood out to me when you reached out or when I saw your resume, I was like, this guy graduated medical school recently, right? So how is it that he was able to get all these research experience whilst in medical school? So there must be something different. So your story quite reflects the depth of the research experience you had even before you graduated medical school and after medical school. So that is really something that would perhaps differentiate you from most medical students on the continent. But I want us to go in depth to the application strategy itself. I know you've applied to the UK for your master's. Is there any reason why you decided to do your master's in the UK?
Yeah, so there's an interesting story behind how I actually even did my master's in the UK. So, first of all, I did the master's long distance while completing my medical internship, while at the same time also doing Fogati Fellowship, plus a number of other research work that I was doing based in Uganda. So the long distance master's really made it easy for me to have that blend of physical work. So I immediately after finishing medical school, I already knew that I certainly needed to be rooted more in research. So I started applying to schools right away, even before graduation. I remember going to the dean's office and then asked for my testimonial, which had my full results, and then decided to just begin applying to schools. And that year, I actually applied to 2 programs. So that was 2022. I remember applying to Harvard actually for a PhD right away from medical school, and then to Imperial College London. At that time, I actually didn't know that Imperial College was actually a big university. I just saw they had this long distance program and scholarship, and I applied for both their scholarships. Before I knew, I received an email from Imperial College London telling me that I'd been admitted and had been given both scholarships. So I had to choose which scholarship I wanted to go for, which there was a Faculty of Medicine scholarship and then a School of Public Health scholarship. So at that time, the condition was that I'm supposed to provide my transcript, which I actually didn't have because I hadn't even graduated yet. So I had to wait some time to then begin. And it's until I began that I actually realized this is a top 5 university in the world. So I didn't go through a particular process of selecting that this is a good university, but I was just really interested in starting an MPH. And I think doing random search online helped me. And I think I am very grateful that I made that choice earlier on, even without a lot of information. Of course, I got rejected by Harvard, but I didn't feel bad about it for one particular reason. I had to do the medical internship to get a license to practice. But that was a great experience for me to start applications as early as that.
Awesome. Yeah, so let's come back to the PhD application itself. Can you walk us through the application process? If someone should start or do want to apply to a PhD in the US, what processes would the person go through? Let's talk about that first. I know you also applied to the UK for your PhD. So let's talk about the US component first.
Thanks for that. So I think usually when they see one has been admitted for a PhD, a lot of people think they are very good. So it was just obvious that they would get admitted. I'm sure you've heard of that before. But just to make it clear, this was actually the 3rd time I was applying for a PhD. So the previous 2 years, I wasn't quite successful, but this was my 3rd time doing so. So I think that probably made this 3rd time of applying a little bit simple because it was a bit familiar. I am not saying easy, but it made my work less compared to if I had started from scratch. Yeah, so I really learned from my previous mistakes because mistake number 1, when I was applying to Harvard 3 years ago, I just went to their website, checked everything, prepared my application documents. I didn't know how they write a statement of purpose. So I just used my personal statement from the MPH because I was applying at the same time and submitted. If I recall very well, I discovered that I actually applied to the wrong program because I wanted to apply to population health sciences, but I actually applied to a PhD in biological sciences or in population health. So the names are very close to each other. That first time of applying at least made me aware of what processes I needed to do. So for example, I had to use the GSAS system, which is used by many universities for application. But I also just discovered other systems offers and so on. So this time when I was applying, I was moving from a backdrop where I'd applied to 3 universities in the previous year. So in 2023, I then applied to 3 universities. And I must admit that when I got the rejection first, I think that's when I discovered your LinkedIn profile and YouTube channel. So for 2023, I actually had a lot of information that I'd gathered from several influencers on LinkedIn, but a lot of that coming from some of your channels and your LinkedIn page on how to write a good statement of purpose, how to write a personal statement, how to reach out to professors. So I applied to 3 universities and reached out to a number of professors, then held meetings with them, and that helped me really understand what their program was like and if there are people who I could work with in the departments, but also helped me to understand really the funding in some of those departments. So when I applied to 3 universities, I had that background work. So I sent in cold mails. I had also gotten used to WES, so I had to verify my academic transcripts and certificate from Uganda to the US system. So I'd done WES for that work already and submitted that as well. So I think for that second round of application, it wasn't as bad as the first. So I had 1 outright rejection, and then I had 2 acceptances. So one of them was without funding, but the other I was put on a waiting list and funding eventually came. But I think it came at a time when I had already committed to other work that I was doing at my institution in Uganda. So I couldn't take on the PhD, but that was a good thing that I was able to get 2 admissions out of the 3. So when I came this time around, I knew that it's sort of a do or die for me. I had to start the PhD, and because of several discussions with my mentors, understanding really some of the challenges I was facing in the field, with some of the technical skills that I knew the PhD would be very important. So because I knew it was a do or die for me, I made it clear that I was going to apply to 10 schools, and that would increase my chances significantly to get at least 1, because I just needed 10% chance to be able to get 1 admission. So I started quite early, and like I mentioned, I had materials from the previous year. Yeah. And this time around, I was very intentional. I think I looked through several resources online. Of course, you had also brought in several videos as well. And it was just really trying to refine some of my work. So I had this strategy, which started really way early in April, I think, last year. So in April, I came up with an Excel file, which I still have up to now. And I think I shared that with you as well. But the Excel file had a list of all the universities I wanted to apply to. There were about 12 universities. I ended up kicking out 4 of them because some of the requirements had to do GRE, and some also required me to do English language tests, which I didn't want to add that as a burden to myself. So I ended up kicking out 4 and then adding 2. So I had 10 universities. So my approach in April was to try as much as possible to do extensive research in each of those universities. So my Excel file had the university, the program, which city it's in, what's its public health ranking, what's the tuition, what's the scholarship, how much do they give in stipend. And then I was listing up to 5 faculty in each of those programs who I thought had similar research that I was interested in. So I did that for all the 10 universities. And then my other strategy in May was now to send the cold mails and to reach out to a number of those professors. So I did that early on in May because I knew when summer reaches in June and July, it was difficult to get many of these professors. Their emails already set to automatic replies. So some of that I leveraged really the good mentorship that I had, that some of the people working in the field where I'd done some work with my previous mentors, or they knew my previous mentors. So I used that to my advantage as well, that whenever I was introducing myself in the emails I'd mention, I'm this and like this, I work with, especially if I knew that they worked with any of my mentors, I would inform my mentors that I would reach out to that person, and then I would send the email. So I did that in May, very early in time, but also looked for all possible ways to see how I can get in touch with some of the mentors who are not responding. So some of those was to see if I am going for a conference, will I find them at the conference? And a particular one is I do HIV research. So I attended the International AIDS Society conference meeting, which happened in Munich, Germany last year. So I made it a point that every faculty, it's the biggest HIV conference in the world. So I made it a point that every faculty I was interested in working with and was going to attend that conference, I was going to make it a point to reach out to them. And it was quite good for me because I ended up meeting several faculty members there and made that introduction that was face to face. And I think that really helped a lot. So that was between May to July. But in between there, I was holding meetings in a number of faculty, but also consolidating on some of the relationships I had made in the previous applications. I then started drafting my statement of purpose. I think my first draft was around June, but that was really improving on the successful one that I had the previous year. So I was using this structure that I borrowed from your YouTube videos and using that structure to try to improve my work. I think that's one of the challenges that I had, the fear to oversell myself, but also undersell myself. That margin, the thin margin between what others would see as showing off, but also being humble enough to know that it's a learning opportunity that you're applying for. So that's what I was trying to really fine tune in my statements and sharing them with several people. I shared it with you as well to try to refine that. So by the time the application is opened in August, most of my application materials were ready. So I gave each of the universities a folder, and in my Excel form, I had clearly indicated which things are needed, and I was tracking. Have I started on it? Have I progressed? Have I completed? So I was doing all those. And my Excel file was also tracking. Have I sent an email to the faculty? Have they responded? Yeah. Have I met them? So I can say I literally almost spent 3 solid months between July and November really working on the applications, almost literally every day, in addition to the work that I was doing. So I always gave some time to make sure I work on those. So I also discovered that there are 2 systems. There are those that use softwares, and then there are those that use their own systems. So I began filling into the systems for all of them. I filled in all that is needed for softwares, but I also filled in for the others. But I also checked whether, so in my Excel file, I also had a column where if they had application fee waivers, I also used that time to send requests for application fee waivers. And I think I sent about 3 or 4 of them and actually got 3. I also got the software scholarship as well. Also at around the same time, I had to do WES for my master's, which wasn't fully completed. So I had that done before August because I know there's usually a lot of traffic there. Yeah, so that's really the timeline. So that's around the time. So also maybe the thing I forgot is that in August is also the time that I informed all my recommenders that I was going to apply. So luckily enough, 2 of them had recommended me in the previous application cycle, and I only need to inform 1 or 2 more to recommend me. So I informed all of them, discussed my goals. I think 2 of them, all the 3 actually, were really my personal mentors for quite some time. So they knew what I was interested in, and they were ready to support that. So that is how I went through that and then submitted all my applications, of course, in November, because I still thought I need to improve more things. And then I ended up submitting to all the schools.
This is an extensive and intentional approach to applying to graduate school. And I always tell people that you have to be logged in. You have to really invest the time and the resources in applying because it's a competitive game you're playing. So you have to, I particularly like the part where you had an Excel sheet, you were tracking all the programs, you were tracking all the major milestones in the application cycle. Yeah. I think that is very useful. So you had your recommendation letters, statement of purpose, and your resume. And I also remember, I don't remember the exact dates, around June, July, we organized a master class. Could you share a bit about your experience with that master class and what you got from that?
Yeah, thanks again for that. I think for me, I really used my experience from the previous year because, so initially, I thought it was going to be easy for me to get into a PhD program because I had seen most of the PhD programs really needed people who have some research experience. I had very extensive research experience at the time, some work experience, which I also had at the time. And I think for my academics, I was really doing well as well. So when I wasn't admitted when I wasn't successful with full funding really on time for my first 2 applications, I knew that I had to change something about my strategy. And then being good isn't the only thing that is really needed here. You need to convey it in a way that would make you stand out the admission committees. So I think I had really followed a lot of your content on YouTube and on LinkedIn as well. So I wanted to have that opportunity to listen in detail, really, what you did, because I think some of the things that were common between our journeys was that you had also initially applied and you weren't successful. So I wanted to understand from your perspective why you weren't successful and what you did different. And I think that's what really pulled me to attend that first masterclass. And I think it wasn't just that one masterclass or about 1 or 2 hours that really mattered. Of course, it mattered very much because then I got in-depth information on the different things that the admission committees are looking for, how to draft your statement of purpose in the best practical way, but also how to arrange your CV. If I looked at my CV probably 5 years ago, you'd know that there's a lot in it, but there's not a lot in it because it doesn't communicate much of the things that are there. So I learned lots around that. But I think the opportunity also to just ask questions and then get feedback. And beyond the masterclass, like I mentioned, was the WhatsApp group that we had this huge number of applicants who are all going through the process. So we had the opportunity to ask each other, ask you questions, but also share experiences. And I remember even some of us were reviewing for each other in the group and say, oh, this is what I did and this is what I've done in my particular situation, because I think some of those were shared experiences. So I think it created this sense of community of those who are trying to apply to graduate school. And then that made a huge difference in the application, because I can assure you that there are times you lose morale with some of this. You'll wonder why exactly you're struggling with some of this work. But when you see many other people also applying and trying to get into graduate school, that was really something great to give you morale and then encourage you to apply as well and make yourself counted in the application system.
Awesome. So I know you also applied to UK. What would you say is the main difference between applying to a US PhD program and the ones you applied in the UK?
Yeah, so I think the main difference for me, first of all, they're all very competitive and they're mostly great programs. So the application process differs mainly, I think, in the requirements. So for the UK PhDs, the requirements are that you submit a research proposal. Some of them are in different phases. So you have like first phase where it's just specific aims or a concise note of what the topic you want to do. And then when you progress to the next stage, which is an interview, then you're required to submit a proposal which can go up to 5 pages. So I applied to Oxford as well, but I also applied to University of Bath. So I think that there are two different, there are many types of funding in the UK, which is different, I think, from the US. So some of the PhDs are funded by MRC through, I think, a number of training grants there. So there is already an established research. You need to reach out to the supervisor first, which is common in both the US and the UK system. I think the difference is in the intention to reach out to the supervisor or the advisor. In the US system, you want to understand what the program is like and then get more details on whether there's a match. In the US system, you want to do that as well, but you want to make sure that they are happy to supervise you with the research that you want to do. Sometimes the research is already established and you want to fit within their research program. So you have to do that as well. And I did that as well and reached to a number of faculty as well and had some meetings with them as well. So the difference there is that you need to have a clear research gap, a clear research program and no problem, and then you submit a proposal for that. While for the US, I think they're trying to, so they want to just know what interests you have, and they don't want you to be particularly clear of what the interest is. Of course, it helps to mention that I am clearly interested in this, but I think the bigger part of the application process was not to know whether you specifically want a certain field, was to look at, one, whether you are a good fit for the program. Of course, it starts with merit, whether you have the merit to be in the program. So that comes with the quantitative bits of the stuff. But the thing is, majority of the people meet that. So they have good grades. People have many publications as well these days. But now they want to understand the qualitative bit of the application. What background do you come from? And how do you fit that narrative into the research you want to do? So some of it is looking at really what diverse mindset you bring to the program and how you fit into the program. So I think the other thing with the US application system is that I would say the system is a bit rigid for the US system. It's fixed. This is what we need and you must have it and things like that.
Yeah.
So for the UK is a bit more, I think, flexible. A series of meetings, of course. So before you apply, you must have an approval. So that gives you some bit of flexibility in choosing who you want to work with in the first place and things like that. For the US, you don't know that. Also, I think the other thing is that for the UK, application fees are very favorable.
Okay.
I think most of them waive off application fees for students. So
I see.
many of them will not want you to actually to pay, especially if you're from an LMIC country. But for the US, application fee is mandatory and it's higher for international students than US based students. So I think that's the other thing. And I think the other difference is the timelines. Yeah, so the applications for the US systems, I think, open around August and end December 1st, others into mid-December. But for the UK system, I think starts a bit late, around October. For others, even November. And then the deadline is a bit late as well. Although for the UK system comes out a bit late. So in March, April, you're doing interviews in Feb, and then the outcomes are coming out around April, which the US system, the application outcomes are usually out at that time.
Awesome. So I remember we were constantly in touch. You were updating me on your interviews that you were having. Could you walk us through how you prepared for those interviews and how that experience was like? Both, I think, the US programs and also Oxford programs. How was your experience like during the interview, and how did you prepare to make sure that you are at your best?
Yeah, thanks. So I applied to 8 US programs and then 2 UK programs. I was rejected in one for the UK, and then I was shortlisted for an interview for the Oxford one. So I had to do that interview. But I'll start with probably the US one, where I think I was shortlisted. Out of the 8, I was probably shortlisted for about 7 of those. And I had to do interview for each of those. So my approach to this was to come from my individual development plan perspective. So in my previous fellowships, I think 2 NIH fellowships, I think one from NIID and then another from Fogarty, we developed this thing called the individual development plan, where you ask yourself, what's the long-term goal? What exactly do I want to be? So for me, I knew I wanted to be a physician scientist, and I wanted to do epidemiology work and then implementation science work. And then you come back and say, do a SWOT analysis for yourself. So I did that for myself. What are my strengths? What are the things that I have experiences in that I have done before, and how did I gain those experiences? And then I asked myself, what are my weaknesses? How did I identify those weaknesses? And I had to be very specific in some of these. For example, I was like, for the previous years, I've done lots of cross-sectional studies or observational studies. And many of these, I think I wanted now to develop my skills and learn other methods like longitudinal studies. I wanted to start doing trials, and that was a big gap. So I sort of did that SWOT analysis for myself and asked, what opportunities do I have? And what things do I need to take advantage of to be able to learn those? So when I was preparing for my application, I made it clear that as a physician scientist, what are the 3 things I want to do? 1, I want to do research. 2, I want to teach. And then 3, I want to do community service, which has the clinical bit of it, but also community engagement and stuff like that. So I asked myself, what skills do I need under each of those 3 sets of things that I wanted to do? So for research, like I mentioned, there are things around 1, methods. So in the interviews, whenever they would ask me, so the formats of the interviews are somehow the same, but once you get what you really want, it's easier to actually respond to literally all the questions in the interview. So for the research, I knew which methods I was conversant with and which methods I wanted to learn. The second thing in research was I wanted to know things about grantsmanship. So I would mention what strengths, how many grants have I won before and how much was that, and where do I want to see myself in the next 5 years or so. Then there was that part of teaching. Have I had teaching experience before? So I didn't have formal teaching experience before, but I had been called for short talks and lectures here and there, but not formal teaching. So I had those, what the clear gap was and what I wanted to gain. And the same thing applied really for community service. So every time I was going for the interview for each of the schools, I made sure I connected what my weaknesses, strengths and weaknesses were to what the school was offering. And so I would match them very well. And I did that extensive research for each school. So for example, for research, I would match it to the faculty and see what kind of faculty do they have in the school? Have I reached out to some? Have I worked with some before? And I think to a great extent, for many of them, I had known their names before. I'd used their work before. Some of them actually knew me before. So I would mention some of those that I knew, some of the faculty. And I think our prior work with them would make it easy for me to go there and learn from their research. The other thing about methods was, okay, I would make it a point to try to go through the course catalog for each and every university. So every time I went for the interview, I knew what courses they are offering, in which year they were offering. I knew who was teaching them. So I would mention I'm interested in learning clinical trials methodology. And at Johns Hopkins, I know Professor Stefan Erard is very good at that, and I want to learn that from him. So I made that very clear connection in that term. So I did that for all those. And the same with teaching, for example, I mentioned that a TA is expected as a requirement for graduation in this school. So I think that's very important. So making that fit to my long-term goal, but also fit within the faculty and the courses that each university was offering, I think made it easy for me to do the interviews. Of course, I was very anxious for the first ones, but when I understood the formats and because the questions are similar, that was easy. Now, when we go to the UK one, was really me presenting my proposal, and then they asked me a lot of questions around my proposal. So I needed to prepare a PowerPoint presentation and then read intensively about the topic. And then I presented that, and I was asked a number of methodological questions and responded to those. So that was really how I approached all my interviews.
Awesome. Yeah. So it shows that you thoroughly prepared for the interview. I always say that getting invited to an interview in itself is an achievement, but that is the opportunity you've been given to prove yourself, why you should be among the lucky ones. It's highly competitive. How many are you currently in your cohort, in your PhD cohort?
So we are 5, probably the smallest number ever.
So they cut down the number from probably 12 or so to 5. So you can imagine the level of competition. So I know, like, obviously the results were amazing. We had a couple of great offers from Oxford and Hopkins and New York and Washington University, St. Louis. How and why did you decide to come to Hopkins? I know we were battling between 2 programs in the US. At a point, we were also considering Oxford, but why did you decide to pick Johns Hopkins?
So what's interesting is that I think that was the paradox of choice. Initially, when I had no choice, I thought it was important to apply to many. But then when I got the programs, it became a headache for me. It's probably one of the hardest decisions I had to make. And I had mentors who say it's good to have
good problems
like that.
Exactly.
You told me the same, that these are having good problems to have so many choices to choose from. But I think why that was really difficult was for each of the universities that I applied to, I had built sort of a connection with the faculty in each of those universities. Yeah. So I was pretty sure that any university that I was admitted to, I wasn't going to have a problem in that university. So all the programs were super good. They had what they were offering, and they were strong at that. So that became very challenging for me. So I think the first point of decision was really to choose between the US programs, because UK admission came a bit late. So I had to go back to my Excel file again and then create another an Excel sheet to try to have all the universities that I was admitted to and compare them side to side. Of course, initially, when I had the admissions, there are obvious ones that I knew these are my top choices. And I had those about 2 to 3 top choices. But when it became very difficult to make those decisions, I asked myself, beyond intuition, beyond emotions and thoughts, what are the objective parameters that each university offers? So I had this Excel file that had everything, especially removing them from what my long-term goal was. So I had things around classes, and I listed all the classes that I thought would be important for my growth, and then compared which one offers the best set of skills that I would want to learn. Of course, all of them would offer, but at this point, I was really looking at which would fill the biggest gaps that I had. And then I looked at faculty, and that was probably the hardest thing because all the faculty were amazing to me. Some of them I'd become friends. I'd worked with several years. So that was a very difficult decision. Some of them were very close mentors, and had written for me recommendation letters as well. So at the point of the faculty really gave me the biggest headache because where do I go? They're all great people. The other thing was, I wouldn't want to call it the other thing, but it is the thing, is the funding package really. I had to compare all the offers and see what funding package are they offering, for how many years are they funding me, and see the stipend. But also in my Excel file, I had the city and the location where each university is and the cost of living. So I had to go deep into research and then see what's the cost of living, what's the housing costs, and then see cost of groceries, costs of those small things, and see would I actually be able to sustainably live in each of those cities. So that made it easy to knock out some of them because some had funding that wasn't guaranteed for all the 4 or 5 years, and some had stipend that couldn't really sustain. And given the cost of living in some of the cities that was there. Yeah, so I think then the biggest headache really came down to 2 universities, and that was the hardest decision because the cost of living were, if you look at the funding package compared to the cost of living, if you do a ratio there, that was almost the same in both. One had very strong package, but a slightly higher cost of living. The other had a very competitive package as well, which was commensurate to the cost of living. Yeah, so I think for me, it really came down to now what I would actually get from the classes themselves. Yeah. They all had very strong classes, but I think I had much more options with Hopkins, with epidemiology classes, because I wanted to be really strong in the methods themselves. And I saw quite a number of classes with that. And a lot of faculty, I think the epidemiology department alone has more than 100 faculty who have primary appointment in the department. So I thought that would be a good opportunity for me to really have that strong set of faculty that are very diverse in literally every methodology. Not to say that the other school didn't have that. They actually had that as well. But at this point, it was really to very tiny details that probably wouldn't matter that much. But I think that was important for me to then make the final decision. Of course, we know epidemiology at Hopkins, it's world-class, well-renowned, and that also played a big point. But I think the other final thing is, which I said there was no difference, was the mentorship. So I think the field that I work in is very tightly niche and neat. So the faculty at Hopkins are working with faculty elsewhere. So I found that it was going to be easy really for me to continue working with my previous mentors because somehow many of them were already working together and that would make it easy for me to make the choice. But yes, it was a very tough decision.
Awesome. Well, now you've spent almost a term at Hopkins. How has your experience been and what advice would you give prospective applicants? Let's tie it together.
So experience, I think so far completed 4 weeks. We just completed our midterms recently. And I think it's been both an exciting but also challenging at first to transition to another education system. I had an experience with the education system in Uganda and then in the UK. And then this was my first time with the US education system. So there are lots of things that were surprising in the good aspects because I think for me, the learning has been a very good experience for me. Just challenged my thoughts, just challenged my beliefs that I had before. And I think because of the small student-faculty ratio, classes have been more like a conversation, discussion. And I think it's a very collegial place to be in. Everyone wants to help you and everyone is interested in the work that you're doing. And there's lots of opportunity to literally engage in so many things that you're actually overwhelmed with the amount of resources and opportunities you have. So the problem you have is how do I choose the best to do? And that can be difficult. But I think overall, the support has been very good. The university's administration provides very strong support for the students. peers as well. You helped me a lot in trying to understand just a few things that you can never ask the administrators. Where do I start with looking for a house and things like that? So that made it easy to sort of transition. I think the other thing is that what made it really easy for me to transition and have a less challenging first 2 months here is that the funding is very competitive. Full tuition for 4 years. They give you a generous stipend, which is sufficient to meet your needs. Health insurance for all the 4 years, and that includes if you have dependents as well. Relocation grant, visa support fees, and there are other sources of fundings as well that I think includes conference, travel, I think, and several other scholarships you could apply for. So I think that makes it easy to study when you're not worried about whether you exactly. So that makes it easy, especially for international students. So I think, so my advice really for prospective applicants, I think being successful with graduate application doesn't really start the year that you apply. I think it starts way back when you make the decision that, you know what, I actually want to pursue this field. I want to get advanced training in this field. So it begins one by creating that network of mentorship. I think my mentors played a big role into where I am now because I've had quite a number of mentors earlier on when I was at medical school, but also during my professional career. So it's these mentors that actually show you what the opportunities are. For example, to build your bio, to build your CV, to be able to get some of these scholarships. So they will put you into their projects, show you what things you need to learn, but also actually make the networking. I have some of probably the most amazing mentors that I know, both in the US and in Uganda, because these are people you go for conferences and then they always set these meetups and then they bring their entire network and then introduce you to their entire network. So these mentors will probably be the first thing. I think that's probably one of the things that one needs to start earlier on to try to get mentors really to support their journey, because it's very difficult to try to break through some of these barriers, especially if you're coming from low and middle income country. So you need that support system. But the other thing also, having those mentors early is that you don't struggle with recommendation letters. So that makes it easy because they actually tell you how you're progressing in your career, and then they tell you that this is what they suggest to you, that this is what you need to take for your next steps. And so when you ask for a recommendation, it's not out of the blue, and someone literally has lots that they could write about you off head without even you sending your CV to them. So that makes it quite easy. So I think one important thing there, mentorship, have that group. And I think about mentorship, and that's my last thing about it, is that peer mentors as well. Most of us look at this as having top faculty as your mentors, but also just having a set of friends or colleagues who you discuss with where you are in your career and what you need to take, sharing the opportunities with you and saying, look, there's an application that you should submit here. So that's also very important. The other thing is to start early. So I think and I'll probably not generalize and say, I was very much used previously to this kind of application where you wake up today, you find an application and then work on all the materials and then submit. So I think what I've learned from the process is that the longer you take to prepare, the better your application package. And that makes it more likely to be recognized by the admission committee. So giving yourself that time to prepare your application material is very important. So start probably 4 months or 5 months before the application cycle opens. So if it opens in August, by March, make sure that you have something in mind already. And that would help you a lot because there are things like West verification. If you did that early, then you will not panic. And I think I panicked for my very first application 2-3 years ago because it was delaying. So that gives you that time. Starting early also allows you to reach out to potential advisors and then discuss with them. But it just sort of prevents you from that last minute panic. It also gives you other benefits, like being able to figure out if the application fee waiver that you needed to apply and submit, because those usually deadlines are early, but also other things, for example, if you needed recommendation letters and all those. So starting early is really important. The other thing, which I already mentioned previously, is that reaching out to advisors. That's very important. People usually neglect that and think it's an open system, let me apply. So even when they write recommended but not required, just put it in your mind that you need to reach out to advisors.
Yeah.
Exactly. I can certainly match out my application outcome to how well I interacted with the faculty in each of those institutions. For most of the institutions where I got rejections, and I'm not saying reaching out to advisors increases your chance of getting admitted. You can still reach out to advisors and then you don't get admitted, but it gives you that extra information on what exactly they're looking for. And the beauty is that, at least with my experience with both UK and US supervisors or advisors, they're really interesting people and they want to help you out and work with you as well. So reach out to them, do that early, do that once or twice exactly. But also use as much resources you can to try to fine tune your work.
Awesome. So mentorship, reaching out to people, starting early, all these are very crucial points. So thank you so much for sharing your journey and your experience with us. Hopefully, most of the prospective applicants would learn a thing or two from our conversation. And that is the purpose of this platform. So if you're new to this platform, happy that you join us, subscribe, and share this with other colleagues who may be thinking of applying to graduate school. So thank you all so much for watching. See you on another episode. Bye-bye.